Welcome back. Good morning, Richard.
Good morning. How are
Um,
things over there? Over there
Good.
across.
Doing well on this side of the office. Hope all is well on your side.
Right.
Excited about the continuing this conversation.
Right. This is the one
Hey.
about making a self-diagnosis.
Yes.
We're focusing especially on teenagers, but most of what we're saying also applies to adults when it comes to self-diagnosis. The difference with teenagers, of course, is that a teenager is in the process of figuring out who they are, developing an identity, and self-diagnosis in teenagers often leads to identifying who you are based on the diagnosis that you think you have. You are more than your diagnosis. The diagnosis can be informative, but it shouldn't define who you are.
Yeah, absolutely. And we talked about a few statistics in the last podcast. We talked about how, almost half, about 45% of kids are exposed to social media by their first birthday, and that they are certainly using social media on average or so by at least the age of 12. And so, kids are using social media more and more often and at younger and younger ages.
We talk about Dr. Google all the time, but
And
teenagers are bypassing many of them are passing Dr. Google, and they're simply using social media, the different TikTok and Instagram and YouTube and all the social media apps to determine whether or not they have symptoms, and if they have the symptoms, do they have a diagnosis?
well,
So.
I think another one that we need to throw out there that we didn't mention last time, and I don't know how much research is out there yet on how often or frequently it's used by teenagers for this purpose. But the other is, of course, AI.
Sure.
You go into Chat GPT and say, hey, I'm experiencing this and this and this and this, and what diagnosis do I have, or what's wrong with me? And AI is going to generate some diagnostic ideas for you.
Right. And that's something that, in fact, the Atlantic has an article this month about another um, um, article about AI, and it is already being used in psychology and psychiatry. And so, yes, you're right. That's going to be another way, another avenue that teenagers can use, and they're already using AI. I mean, high school students are becoming very good at using AI. They're going to get way ahead of us, and we're not going to be able to catch up.
Mhm.
So, yes, AI should certainly be on the list.
Yeah.
Okay.
The other statistics that we mentioned is that about 6%, just over 6% of children, they have multiple accounts, and they often have hidden accounts. But I think as a result of, the fact that they're using it more, they're using it in ways sometimes that we don't know because of some of the hidden accounts and things like that. I think the statistic was that 71% of teenagers have
Hmm.
made a self-diagnosis before they even see a professional.
Right. Right.
And so think about that, three quarters, just about three quarters of all teenagers who end up seeing a professional
Hmm.
have already made a diagnosis. So that means that they go into that first session with a professional already thinking that they have something in particular.
Right.
And, as a professional, what that means is that they're going to come in and they're going to present information
Hmm.
to enforce or to reinforce or to support that diagnosis, the diagnosis that they believe that they have. And so they're going to talk about things in a way to confirm that diagnosis, because what they're there for is, maybe it's their parents want them there or whatever, but they want to confirm that that's what their diagnosis is. And so they're going to talk about it, whether they're doing it. I don't necessarily mean that they're doing it maliciously, like they're trying to manipulate the system or anything, but it's natural to think that if I have this diagnosis, they're going to talk about it as though they have that diagnosis.
And when they come to you, the problem today, this is fairly recent in our field because there was a time when teenagers come into our office today, they frequently come in and they announce to us that they have a diagnosis. It might be I have ADHD, I'm autistic, I have DID, and they and three times out of four, 71% of cases, it's a self-diagnosis.
Mhm.
And it's been reinforced by other kids, probably internet friends, who have similar symptoms. And so there's this group, this social friend group, all of whom have this particular diagnosis. If you don't agree, if you
Mhm.
don't agree fairly quickly in the interview, you alienate the teenager
Right,
because they think you either are stupid and you don't know about the diagnosis, or that you're denying them the diagnosis and you're trying to tell them they really don't have it, and then you're going to alienate them.
right,
Okay. And because once they have it, once they have made a diagnosis and they think of themselves as a diagnosis, it is very, very difficult to move them away from that, to say, well, wait a minute, maybe you don't have a diagnosis. That is a dangerous thing to say to many teenagers who
right.
are convinced that they have a diagnosis.
Yeah, you have to be very, very, very careful because the big problem with self-diagnosis, especially in teenagers, is that, and we kind of touched on this in the last podcast, but adolescence is this time of identity development
Yeah.
where
Yeah.
you're trying to figure out who you are.
Hmm.
If during that time you become introduced to the idea or convinced of the idea that you have a particular diagnosis,
Right.
what tends to happen, what we're seeing happen a lot in teenagers, is that that diagnosis starts to become part of their identity. It's
Exactly.
not that they are, you know, a person with symptoms of something. They are autistic. They'll say, I am bipolar. I am
I
autistic.
am.
I
Mhm.
am ADHD. And sometimes they'll use have, I have autism. I have, but in other ways that they talk, it is definitely certainly represented or presented as part of their identity, part of who they see themselves as. And
Right.
and that's so concerning
Right.
because A, if the diagnosis is not correct, they're self-identifying as something that they
They're not.
the
Hmm.
diagnosis that they don't have. And and,
Right.
and two, it again, we kind of talked about this last time. They keep behaving in ways that support that diagnosis, which is going to further press them down a path that they don't necessarily need to be going.
That's right. The irony here is that for many, many years, we in our field said we don't want to say you are autistic.
Right.
Want to say you have autism. You are not learning
Person-centered.
disabled. You have a learning disability. Because if you say, I am learning disabled, you're sort of automatically saying, I can't.
Right.
Whereas if you say, I have a learning disability, well, let's figure out what to do about it. So
Right.
when you tie together a diagnosis with your identity, that's what teenagers are doing. And we spent many, many years moving away from the idea that you are your diagnosis. You're not diabetic, you have diabetes. Okay. So we want to make sure, and that's the irony here, is that now teenagers or anybody who's self-diagnosing, they're saying, this is who I am. But if you do that, if you make a diagnosis as a teenager and teenagers are trying to figure out what their identity is, you can see how easy it is to confuse the two or to combine the two.
Absolutely. And I think that as we see how this plays out,
Mhm.
what tends to happen is that complex experiences that we all have, uh,
Right.
ADHD, adolescence is a time of complex experiences, you
That's
know,
right. Right.
between the dynamic social relationships that we have at the time, this massive transition from childhood to adulthood,
Hmm.
this seeking of independence and this, need to, we call it launching, that where you're leaving your home of origin, your family of origin, and you're striking out on your own. All of that happens in this adolescent period. And what I think that what's so unfortunate is that when teenagers make a diagnosis and use that diagnosis to identify as part of their identity, and then they use that diagnosis to help explain some of those complex experiences that they're having, they're
Hmm.
not allowing themselves to experience those things in a way that's going to help with
Right.
their overall development.
Right.
It is supposed, I'm gonna say it, I'm gonna say it. It is supposed to suck sometimes. Life is supposed to be really hard
Right.
sometimes
Hmm.
because when it's really hard, then you learn to overcome some of those challenges so that when you meet the next difficult thing, you have some tools that you can use to overcome that one.
Right.
It is supposed to be that way. I mean, that's how we grow and learn and develop and mature.
Right.
When we say, I can't help it, you know what, I can't get a job because I have anxiety.
Right.
Okay, now and then if everybody then agrees, okay, yeah, anxiety is so bad they can't get a job. Okay, now you have a situation where a person may not be able to go through some of those life experiences that they need to go through to be able to make that healthy transition to adulthood. And we get in this cycle of, just going round and round where you become so limited. Your
Right.
world becomes very, very small to where again, the only thing that person may then have is
Hmm.
those people on social media that are reinforcing that, yeah, you are pretty impaired. You can't do those
Yeah.
things. So,
Right. Yeah. So one problem is you you become the diagnosis.
mhm,
Okay, that's one problem. The second problem we run into is that many times, many teenagers use the diagnosis to justify poor behavior
yeah.
or to justify poor decision making.
Mhm.
And you run into things like, well, I can't go to school. I have to be homeschooled because I have DI. I have to be homeschooled because I'm anxious. I have to drop out of school. I can't do this. I can't work. I can't work full time. No, that's the other problem is you're using the diagnosis to limit uh,
Mhm.
your life experiences. So we want to begin by at least entertaining the possibility that you don't have any diagnosis.
Mhm.
Okay. We certainly we don't want you to tie up your identity with the diagnosis, and we don't want you to use the diagnosis as an excuse
Right.
for limiting your life.
Right.
So, but once it's confirmed by all of your peers, and you have this friend group, all of whom have the diagnosis or supposedly have the diagnosis. Once it's confirmed, it's very difficult to move the person. So we want to at least entertain the possibility that you have no diagnosis, or the second possibility is, well, you really don't have this diagnosis, but you do have this diagnosis,
Right.
in our professional opinion. But because they don't know us and trust us, I mean, think of it. A teenager has been told by 12 other people, 12 peers that, yeah, you have it. And then they come in and see us and say, no, you don't. They're probably going to walk out of the office because they're
Right.
not going to believe us. We don't have the same weight that the peer group does.
Right. Yeah. So when we think about what a diagnosis should be, it
Mhm.
should, yes, it should help explain why a person experiences some of the things that they experience. Absolutely. It should explain it accurately, not not conveniently. It should explain it accurately. And what I mean by that is, it's easy to say, "Oh, I have ADHD. That's why I don't listen and follow directions from my parents." Okay, that may be very convenient to help you get out
Right,
of not listening to your parents.
right,
If you don't have ADHD, that's an excuse. That's a using it to, get away with that bad behavior that you were just talking about.
right.
If it is an accurate explanation, the other thing that it will do is it will lead to intervention.
Right.
What are the strategies that we use to help a person who has ADHD, who has a hard time following directions that's given to them by other people? What do we do? How do we correct that? How do we address that? How do we intervene with that? That's the purpose of a diagnosis. A diagnosis isn't an excuse, it's an explanation so that we can then develop interventions to help treat those symptoms.
And it makes me think of a person who has a vision impairment. You're going along and all of a sudden you don't see as well as you used to. Who in the Can you even imagine somebody saying, "Well, I have this vision impairment, and so I just have to live with it"? No, you would go have it corrected. You'd get glasses or you'd have surgery
Right.
or something to fix your vision or to fix your hearing. Or, well, I've broken my leg, so I guess I can't walk anymore. No, you would go get it fixed. You would seek an intervention. It's the
Mhm.
same with mental health. Mental health, similar to physical health, you would seek an intervention. And I can't stress that enough. A diagnosis is an explanation and it's a path to intervention, whether it's a physical or a mental health issue.
Yeah.
It's not a hall pass. It's not an excuse
Right.
to avoid life.
Right.
Too often, it's teenagers use it, not only teenagers, many adults use it as an excuse. It's
Right.
an excuse for not working, for not going to school, for acting inappropriately, for imposing yourself on a, well, I'm autistic. So, no, you have autism. Now let's figure out what we're going to do about it.
Yeah. And to me, where all of this leads to, and Rich, I'd love to hear your thoughts about this too, but all of this leads to is, and I find myself talking to more and more especially teenagers about this, is, you know, what type of when I'm talking to a teenager, one of the things I'll ask them is, what type of person do you want to be? Like, who
Mhm.
do you want to be? Like, you
Mhm.
want to see, let's think about, personality characteristics or just different life characteristics for yourself. Who do you want to be? You want to be a good friend. You want to be somebody who's dependable, somebody who's reliable, somebody who, can accomplish tasks. What type of person do you want to be? And if we're not careful, what teenagers will often do is they will, even in those descriptions, they will be housed within this diagnostic framework that they've created for themselves.
Mhm.
But I think it's so important for teenagers to figure out who they want to be because the goal needs to be for them to work towards being who they are. You be you. Don't be, you don't have to be a depressed. You don't
Mhm.
have to be an anxious.
Right.
You can be Richard.
Mhm.
You're you. You are you yourself as an individual and sort of a collection of all kinds of experiences and all kinds of things and beliefs and thoughts and ideas. And that's you. Now, if you're you and you have some depressive symptoms, just treat those depressive symptoms so that you can then manifest you as you.
That's
If you
right.
have some ADHD symptoms, let's manage those ADHD symptoms so that you can manifest you as you. The problem is that teenagers don't necessarily think that way naturally, um, to the point where they can differentiate,
Right.
some of those symptoms and characteristics from who they are as a genuine, real person.
That's right.
And it is so hard sometimes to walk them through that process, but it is so important for them to figure out who they are and who they want to be as an individual.
That's right. So we've questioned, do you have the diagnosis? But let's say you do have a diagnosis.
Yeah,
Okay. So you have a diagnosis. So you have an extra burden to deal with now. I'm sorry. You have this diagnosis. This is your burden. We all have a burden. We all have something. Okay. This happens to be yours. And it is on you to it
yeah,
is on you. Others can help you. Others can
right,
But you have to do the work. You have to take the medication.
right,
You do your own therapy.
right,
Okay. That's yours. If you have a diagnosis, now you have some work to do. You
right,
can't just sit in your bedroom and say, well, I can't because I have a diagnosis. No, that doesn't give you a license to isolate
right.
and to make excuses and to absolve yourself of any responsibility. You still have responsibilities.
Right. And it's, it is not to say that there are people who have those severe experiences
Mhm.
that it does cause impairment. We recognize that. That is a very small portion of the population, though. So
Right.
let's recognize that. And so we are not talking about that portion of the population. But I've mentioned before on the podcast, I've been diagnosed and I take medication for ADHD.
Right.
Um, had I taken, I can envision, I can look back and say, had I decided not to recognize that diagnosis and not to seek treatment
Hmm.
for that diagnosis and use that as just, this is part of who I am. I can't help it. I can't do anything about my ADHD
Right.
symptoms.
Hmm.
I know that I would not be sitting here.
Right.
I would not be doing the work that I do because I wouldn't be have been able to manage my symptoms well enough to complete grad school and to complete all the other obligations that I had.
Hmm.
Um, but you when you recognize that you have those things, because I see that as separate from me.
That's right.
I can
You're not.
I know who
Right.
I am,
Right.
and then I have this other,
Hmm. Hmm.
thing that influences
Right.
how I can present who I am, and so I have to deal with that.
Right.
I have to manage that. I have to deal with those symptoms,
That's right.
and so I do. If I choose not to one day, I've got to
Hmm.
experience the consequences associated with that. All right, but otherwise, I have to be who I am. And again, we really want teenagers to realize that and to do the right thing by making sure that if they do have whatever it is that they think that they have, whenever we get a diagnosis, then you got to do the treatment,
Hmm.
because
That's right.
that's the other part of it, right? Is they say, oh, well, I have DID, but man, I really didn't want to be here. My parents are making me be here. Okay, well, you're saying that you have this severe mental health condition, but you don't even want treatment for it. It's
That's
causing all these problems in your life, but you don't want to do anything about it.
right.
Like,
Exactly.
how does that work? Like, how is it that you want to use it as an explanation or an excuse for something,
Hmm. Hmm.
but at the same time, you don't want to get any treatment for it. You don't want to do what you have to do.
And you can't have it both ways. You
Yeah,
can't use it and just ignore it. You still have the responsibility,
right,
okay, to do the right thing. You have to do the right thing. You have to be involved in your treatment. You have to go to the doctor. You have to take your medication. You have to do all the work that is necessary to manage your diagnosis. It
right,
doesn't give you a free pass.
right. You can't. It is unreasonable. And I'm sorry, teenagers, but this is the reality. You can't say, Um, I feel depressed. I self-harm. I do this and this and this, but I'm not going to tell my parents. Parents, I'm going to tell you that I have those things, but I
Right.
don't want you asking me about it. Your
Right.
parents are
Right.
going to ask you about it. They're going to worry about you. They're going to worry about what you're doing. And yes,
Right.
you're going to react to those things. But you can't say I'm going to do these things. I don't want treatment. I don't want to talk to anybody about it. I don't want medication. I don't want therapy. I don't want any of those kind of things. And I don't want you asking me about it. I'm
Right.
just going to sit here in my room, dark, on my computer or on social media, talking to other people about it, ruminating over it. But I don't
Right.
want you to ask me about it. I don't want to do
That's right.
anything about it. Just think
That's right.
about how like ridiculous that sounds.
Yeah, and this whole idea of I can't because I have something.
Right,
No, you have to because you have something.
right,
Okay. That's where I want to move these teenagers. Get out of your bedrooms, get out of the dark, and get back in the world. Yes, you have a diagnosis. So now you have to live your life.
right.
It's not your ticket to spend your day in a dark bedroom on the internet. Okay.
Absolutely.
So there are things that parents can do. I mean, you don't have to throw up your, what do I do about this? And there are some things. And unfortunately, we're going to rush through these, but they're in the show notes, I think, from the podcast for the 20,
Website.
they'll be in earlier, the previous podcast. Um, One is there is such a thing as the clinical social media assessment protocol, and that is that you need to educate yourself um, about the sites that your kids are using, the hashtags, the trending, these ideas of what is out there? What are my kids accessing?
Right.
And if you, as a professional, as a teacher, a psychologist, a psychiatrist, a parent, you need to know what sites they're going to, what the hashtags are. Go to the internet, do hashtag bipolar disorder, and see what your kids are finding when they use those hashtags, and what's trending. These are things that you ought to be accessing.
Absolutely. You also got to look at, social media hygiene, and that can, you can get a therapist for that. You can
Right.
do that kind of thing. But really, you got to look at what social media your kids are using,
Mhm.
or, your patients or your students or whoever, what social media they're using. In addition to you being familiar with it, you got to see what they're doing on it.
Right.
And I know that teenagers and kids want privacy. They don't want their parents,
Mhm.
doing, but it is okay for that to be a condition.
Right.
The condition for you to have these social media accounts is that I have my social media accounts and I follow you. Um,
Right.
and if I find that you have other accounts that I don't know about,
Mhm.
then we're going to have to talk about whether you're going to be able to continue to have that those accounts or
To
not.
have access. Right. Mhm.
But that has to be a discussion that you have at the very beginning, from the start of things.
Right.
You can't, it is unreasonable, parents, for you to
Mhm.
say, my 15, 16-year-old is not going to have any social media.
Mhm.
And not that it's not reasonable, it's okay to have that expectation, but you have to anticipate that there's a possibility that they're going to get one anyways.
Right.
You know,
Right.
how many 11-year-olds? I know 11-year-olds who have secret Snapchat accounts
Exactly.
that
Right.
their parents don't know about, and they just do it. They access it online because you can access it online. You don't have
Right.
to be on a phone or a tablet or something. So it can happen. Just have a conversation with your kids about this to know what their social media use is.
Yeah, and find out what these digital mental health companies are. That you can get. I mean, there are companies that are
Right.
available all over the country right now. You
Yeah.
just type it, find out what's out there. What are your kids accessing if they access these online intervention companies or diagnostic companies? Bernie, we know a lot of people who have never seen a person in person
Right.
who end up with a diagnosis.
Right.
I don't. I think it's
Well,
dangerous at the very least.
right.
You know, if you've never met with somebody, if you don't know anybody, you can hear what their symptoms are, but is that sufficient to make a diagnosis? So avail yourself, find out what's out there, what your teenagers are accessing. They're going to be way ahead of you. They're going to be doing things that you're never going to know about, probably because they have a digital intelligence that we don't have, that
Yeah.
most of us don't have.
Yeah. So as we're going into this, and
Mhm.
again, there's a link in the show notes to all the articles that we kind of pulled some of this stuff from. But you can try, parents. I know you can try prohibition. You can try to take everything away from them. Um, and for some parents that will be successful. For
Mhm.
most others, unfortunately, it won't.
Right,
Um, because they're going, it is part of their world. Social
right,
media, these devices, it is part of their world.
right,
And most parents don't want to send their middle or high school student to school without a device.
right.
It's just the reality.
Mm-hmm.
Yes, there are some that can do it successfully and not, there are lots of you know, uh, individual studies, an N of one study. So like an individual who
Right,
will write an article that says, my kid didn't have a cell phone until they were a junior in high school.
right,
That's great. Um,
right,
but those are unique situations and often presented in a much more um, clean way than their life experience probably really was. You
right,
I'm not saying that they're lying or anything, but
mm,
they're not necessarily presenting everything that actually happened
right,
those
right,
years. But so you can try prohibition. It may or may not work, but you have to keep an eye on what's happening.
right,
If you're going to let them have some access, or you recognize that they're going to have access, you
Hmm.
have a conversation about it so that you can be a part of what they're doing.
Hmm. Hmm.
So
Right. That's
it,
right. You either you can observe from the sidelines. You can say, "Well, I'm not going to fool with all that stuff," and your kids will. Or you can enter the social media spaces just with curiosity or competence. Um, I myself, I have to learn about this stuff. I'm illiterate when it comes to social media, but I need to know enough about it to
Mhm.
talk, to know where my teenagers are going
Right,
and what they're doing and where they're headed. So it is my obligation to learn about this as it is to learn about everything else that they're doing.
right.
Okay. And you
Yeah,
you may not want to fool around in social media, but you need to know what's there and what your children are actually children and teenagers are accessing.
right. Yeah.
So,
And I guess the final thought is it's not so much whether social media is going to have an influence. It's
no.
just whether or not we're going to be prepared and equipped to help our kids through some of that because
Yeah.
um, it's going to have an influence. And so
Yeah.
we
In
just
the
have to be
last
ready.
podcast, you mentioned AI. I mean,
Right,
okay, we need to know about AI. It's here, it's coming, there's more
right.
of it coming, and you have to know about it. And you're going to have to take time. If you have children, then you have the responsibility of knowing where they're going.
Absolutely. All right. Well, that's it for today. We'll be back next week for
Right.
conversations about all kinds of different things. So until then, stay happy, stay healthy, and forget to be afraid.